Hi, doctor. I'm 40 years old. I had two miscarriage, two ectopic, and two IVF failure. What to do? Please help me. All tests have gone like have done like genetic, apply, etc. All are okay. My one tube has been removed due to ectopic.
Okay. Parul at 40 years and two miscarriage, two ectopic means that means she had four pregnancies.
Pregnancies,
So
right?
yeah, it was not a problem for her to get pregnant. Maybe her age factor is a very important thing. We have to look out because her quality of embryo could be poor at this age because of the poor quality oocyte also. This is just a probability.
Hmm.
I would advise in this case to her to take an AMH test, the latest. Has she got a AMH report? Is she on a chat now, or is it only a
Yes.
question?
So, actually, this message is from YouTube. So, your live
Okay.
is the live is on YouTube also. So, we are like
Okay.
our viewers can see this particular live on three social medias: Facebook page,
Okay.
Facebook group, and YouTube. So, please, if you are in the session, please do post another. Like part of your question that doctor will just mention,
Yeah.
and then we
I
can.
want to know like if she has done the latest AMH because at 40 there is probability that her AMH would come down. So in that case, it is better that she has to plan for an IVF, and even if there are very few embryos, she has to have a pre-implantation genetic testing of the embryos before we transfer the embryos back.
Right. So she's saying yes, she's online. So please, ma'am, could you please repeat the question? What all details you really want
Yeah,
from her?
no, I want her to know. I mean, I want her to tell us if she has done a latest AMH test, blood AMH.
Okay, so please, yes, the AMH is 0.98.
Okay. If it is 0.98, I would advise Parul that she goes in for an IVF program again. And how many ever embryos she get, those embryos have to be subjected for a PGTA. Okay. And that is to make sure that we are seeing the good embryos and then transfer.
Okay, so when she had first IVF, she
Yeah,
was.
she was only 33 years at that time. Now it's 7 years gone. So she should not waste any more time. She could actually go in for another IVF cycle, but plan to do a PGTA, that is the pre-implantation genetic testing of her embryos. And when we find that the embryos are good, any one or two embryo is good, she can go for a transfer.
Right. So if Parul, you still have some few embryos in frozen state, then you can ask your doctor to do PGT. Okay, she is saying that donor bhi fail ho gaya. The donor cycle also failed.
Oh, really? Okay.
Mhm.
Out of the two cycles, she had one of self cycle and donor before. Okay, okay,
Mhm.
okay. Mm. I would actually ask her to be a little more bold. No problems because look, mm, 6 to 7 weeks
7
में
weeks.
miscarriage हो जाता था. Yeah. So that means to say that probably we are looking at what about her husband's sperms quality is one thing we should really look at now, because if he has good quality sperms, that's fine. But if there is anything like a teratospermia or abnormality in the sperms, also sometimes abnormal embryos can be produced. If his some semen analysis was very normal, then let Parul do one more um, Self cycle can be done. Actually, at 0.98, I would actually recommend her to go for a self cycle once again and send the embryos for PGTA. If PGTA embryos come out as abnormal, then accept that things are bad because of the age and then go for a next donor cycle. Okay, her endometrium is it? What is that? 45 mm?
I think maybe she's discussing about male parameter.
How millions?
45
It's 45 millions. Okay, could be. Yeah. Millions. Yeah, that means to say the count is good.
count is good, right?
Count is good. Count is good. So she can definitely, because in IVF, if there is 45 million, what we require at this age, if she will be producing about 6 to 8 eggs, that's actually good. So we need that many sperms only. So I don't think I mean, she can go ahead for one more IVF cycle, but please recommend that. I would recommend that she has to go for a PGTA of the embryos.
Right. And if you really want online consultation with ma'am, please let us know. We'll arrange for that. And don't worry, as doctor said, that yes, you can move ahead with one more cycle. Just do the PGTA so that we can really know what is actually happening with your embryos. We can
And
understand
one more
the
recommendation is probably if she's not done a hysteroscopy, because she mentioned to us about one uh, miscarriage also. So better before transfer, she will just look at the endometrium also.
right. So she don't have any preserved egg, so that she need to go ahead with a
Fresh
fresh
cycle,
cycle.
fresh cycle. Yeah.
Right. So we would advise that please don't wait. Age is 40. We all know that. So waiting period is not there for you. Please, like it's don't mind, but it's the actual thing.
Yeah, if 0.98 is the latest AMH for her, done very recently, then she can try her own eggs again. If AMH is done earlier, let her repeat one AMH now before she really decides upon self cycle or go ahead with a donor cycle.
Lunar cycle, right. So Dr. Dakshani here, I just